Hi, good morning, happy Monday. It is Natasha from the Fun Thriftaholic Mom. I am doing a video on Kesimpta this morning. I am actually going to be taking my first injection for the new year today while I'm talking to you. I've done a video like this before, and it did well. Since that video, a lot of you have reached out to me, thanking me for doing this video, asking me questions. Several of you are just getting ready to start Kesimpta. I would love to know how you are doing with this medication, if you're having any problems, anything like that. If you are new to my channel, hi, thank you for coming and viewing my videos. Again, my name's Natasha. I am 40. I was diagnosed with MS November 1st of 2007. Since then, I had taken several different medications, Rebif, Copaxone. My most recent one before Kesimpta was Tysabri for a long extended period of time. Some of those didn't do well with my liver. If anybody knows what Tysabri is a intravenous drug that you have to go into an infusion suite. Yes, so Tysabri is a drug that you get done every month. It is about an hour and a half worth of time from them taking your vitals to getting the medicine intravenously. Then you usually have to do a full or half bag of saline afterwards. And they just want to see how you are, if there's any reaction or anything. I did that for several years until moving here to Arizona from Colorado. With my new neurologist, you have to get obviously blood work to find out where you're at and everything. And in doing so, my JC virus, I was always negative every time that I was tested in Colorado, but I actually came back positive. So I had to make the decision on continuing this medication, knowing what the risks were. If you have not done research, definitely do your research before you decide on a medication. You should look up the JC virus and what that entails. The information that you find can be pretty scary. But anyways, that worked well for me, I thought. And then I had to make a decision, and ultimately my husband and I decided that I would do Kesimpta. And so I feel like I've been doing pretty well as far as maintaining. I also think moving here to Arizona and the altitude and weather is helpful. I had a pretty emotional video just recently that I did on how much better I'm feeling within this last year that we've been here in Arizona compared to how truly sick I was in Colorado. I will leave a link to that video if you're interested in watching. But anyhow, today's video I just wanted to do just a recap if anybody is new and is interested in Kesimpta for MS. This is how it will come. It will come in a big, huge, cold box and that you open, and this is the only thing inside of it. This is a self-injecting Kesimpta pen, and it has all of your information. I blurred it out for this video, and then the name of the medicine, the prescription, the milligrams, and that this is for a one-time use. And so I'm going to open it. And so it always comes with directions. And then this is the actual pen itself. That's what it looks like. And again, you only use this one time. When you receive this a couple days before your actual injection, make sure it does not freeze in the refrigerator. And then the morning of when you're going to take this medicine, you want it to come back to room temperature. And then when you inject, you can inject in your arm here, or in your stomach, or in your thigh, wherever you would like to do it. Today I'm going to show you how I'm doing it, so I'm just going to, I'll probably just do it in my arm. Maybe I'm gonna have to do something else, but I'm probably gonna have to go get a different shirt on in order to do that. So, but this is the way that it looks. It has the expiration date there, the name of the medicine, the dosage, all of that. So I'm gonna go get a different shirt on so I can inject with you guys here on video. Okay, I'm back. I changed shirts, but while I was up, I went and got myself alcohol wipes. Those will be included in your monthly medication. And then also from your mail order pharmacy, they will send you your own biohazard container for your used Kesimpta pens. So the first thing you do, I'm just going to open my alcohol swab. Just going to open it and lay it there. So then you just twist off the top. So this is just throw away. And then inside here is your, do you see the, you should see the needle inside there. So all you're gonna do is this whole thing presses up against your skin. Then you're gonna hear a pop and you sit there for another 30 seconds while it continues to inject. And I'll show you the best that I can how that works, and you can listen for the pop. So I'm gonna put it in this arm. I'm going to wipe my arm with alcohol wipe. And again, you can do this in your arm, you can do this in your stomach, or you can do this in your upper thigh area. So I'm just going to, I'll turn this way. Hold it there. And just wait another 30 seconds. You see how it turned? It turned green. It's green now. That means it's used. And so this whole thing gets thrown away. And then every month they will send you a whole new one. It's not painful really at all. And it barely left a mark at all. Just a tiny little bit of blood. And just wipe it off. And then all of this gets thrown in here. And I put my alcohol things in there too. So that is how the Kesimpta pen works. If you have any questions, that was kind of fast, but there's really nothing to it, guys. You just twist the top off, and you hold it up against your skin, and the self-injector pretty much does the rest of the work for you. And I haven't noticed any side effects or anything with my infusions. I used to have to come home and sleep for a little bit because I felt super nauseous, but I haven't really felt like that with Kesimpta. I feel like it's working pretty well for me. Again, I would like to know any comments that you have, and also I'll just give you weekly updates. I do have a nerve study that's going to be done on my legs and my feet because I'm having a hard time getting up in the morning without pain in the bottoms of my feet, and then also a lot of cramping in my lower part of my leg. So they're going to do some type of nerve study to see if those things have to do with the pain that I have in my back. I also have degenerative disc disease that I found out about after all these years, after moving here to Arizona and getting a 360 x-ray done of my entire body. It was about 4 pages of different things that they found. I mean, they listed all the lesions that I have, where they're located, and all of that. So I hope this is helpful. Again, if you have any questions or comments, I would love to hear them. Just leave them down below. And if you want more videos like this, just like and subscribe. I do other videos. I'm starting budgeting, savings videos. I'm also doing a low-carb diet. I do cheat 1 meal a week. I'm not counting pounds on the scale. I'm just going off of inches and how I feel, and how my clothing fits, and I can tell a difference already. It's been probably 3 weeks. If you're interested in any of the recipes that I have found that I love, I would love to share them with you through a video. If you want to just leave a comment about that. I found a great peanut butter cookie recipe with syrup and peanut butter, and then also a cinnamon roll recipe that was really good. So just let me know. Again, also if you don't know, I also sell on Poshmark, eBay, and Mercari. So I do Poshmark videos as well, and also I'll be doing a FLyp video if any of you are interested in that. That will be coming up soon as well. So I hope you guys have a great Monday and a fabulous week, and like and subscribe. Have a good day.